Everybody. Happy Tuesday. Good evening, everyone. I'm Dr. Joaquin Acosta, your guide and companion on this enlightening journey of health and wellness. As the CEO of Pharmtrue and the host of the Know Your Pharmacist Livestream, I'm thrilled to welcome you to tonight's show where we connect, collaborate, and create a space of learning and growth. Tonight, we're diving into a world where science meets compassion, where innovation intertwines with care. We'll explore the dynamic of ever-evolving landscape of healthcare, focusing on how AI is revolutionizing our approach to wellness and patient care. It's not just about the technology, it's about how we as a community harness this power to bring about positive change and better health outcomes for everyone. In our Pharmacist Frontline segment, sponsored by the visionary team at Pharmtrue, we'll discuss the latest in pharmacy news, emphasizing the importance of staying informed and proactive in our health journeys. Then in Tech Talk, we'll delve into the fascinating world of AI and healthcare. We'll brainstorm the possibilities, address the challenges, and envision a future where technology and human expertise work hand in hand for the greater good. Our Enlightenment Hour will take the discussion deeper, examining the ethics and future prospects of AI in healthcare. It's a conversation about safety, accountability, and the incredible potential of AI to transform lives. In the Herbal Wellness Corner, we're going to be going over again the amazing Black Friday deals all week long from High Horse Cannabis Company, guys, showcasing how cannabis can truly complement traditional medicine in our pursuit of wellness. In our community spotlight, we're going to shine the light on Food for Paws Pet Food Drive, a heartwarming initiative that reminds us of the power of community and compassion. And finally, in our Men's Health Minute, we'll break the silence on men's health issues, fostering awareness and understanding in this vital area. Movember time. So sit back, engage, and let's embark on this captivating journey together. Your thoughts, questions, and insights are not just welcomed, they're essential. Together, we're not just learning, guys, we're transforming the landscape of healthcare. So settle on in. Let's talk a couple things. So first, quick update on the Pharmacy Frontline. Going over some pretty interesting news during our holiday season, guys. I think it's pertinent. So check this out. As I get it all set up, excuse me. So Walgreens to close nearly all pharmacies on Thanksgiving for the first time. Pretty impressive. Sounds like, what can I say? Maybe the strikes, Pharmageddon, some voices were heard. So guys, what does that mean for everybody? If you fill medications at Walgreens and you might have been planning on picking up on Thanksgiving again, you should be trying to get your meds assembled, the day before Thanksgiving anyways. I know it's really crazy, but for those of you guys who do use Walgreens, please keep that in mind. CVS, those 24-hour locations are going to be the only guys in town open Thanksgiving Day, and we do salute all of our pharmacy teams that are out there working those shifts, hospitals as well. So guys, if you do see your pharmacy teams working on Thanksgiving, please give them a thank you. Please get them a plate, as always, for sure. But I think this is some interesting news right now. It sounds like, Walgreens was listening to a little bit of something, closing for the first time ever on Thanksgiving Day. Just about all their stores, guys. I think, pretty, interesting news for how far the pharmacy protests have come, especially even in the last 2 months. So anyways, happy Thanksgiving. Other than that, guys, keep your medications and try to be adherent as possible. We should be 100% adherent, right, during every single day. And during the holidays, I know things get even harder, lifestyle things get harder, stress goes up, all of those things. But again, for all of our patients out there that do take medication adherence is absolutely top of the line. And for holidays being a time where, it's easy to up the stress, up the weight, up everything, all of a sudden, it's really easy to really get behind if you're not taking your medications on top of that. So if you're at top of mind, you're knowing these things are going to happen, you can be preventative to some degree, and you can just understand and embrace, the changes of the holidays for what it is, and, go from there. But otherwise, guys, be careful. Cold and flu season, as well as RSV, So flu, COVID, RSV are all out and about. They're going to be spread here during the Thanksgiving break. Don't get me wrong there. So we already know that that's going to be a thing. If you're not vaccinated, you have the time to get the vaccine before, sure, great, but you're not going to get the immunity or positive benefits, by Thanksgiving Day by any means. So anyways, what does that mean? Wash your hands, watch your droplets, just be considerate. Don't kiss babies. So, all right, let's get into the tech talk, guys. Very interesting stuff. So for those of you who haven't seen, and really, for those of you who do care or don't care, basically the shakeup of this company, OpenAI, they are one of the big generative AI tech companies, right? They're the guys who do ChatGPT and so on and so forth. Anyways, their big CEO was ousted in a coup that ended up causing a big shift in the way, artificial intelligence is being viewed and in healthcare. So that CEO went over to Microsoft to go help in their artificial intelligence strategy and department, so on and so forth. And that's pretty cool the way that's happening. But again, those players there, like Microsoft and Google, the concern is that now we're entering a Coke or a Pepsi moment where there will only be a few big players in, like generative AI, such as right here, Microsoft and Google. And what that's going to mean if you have, this kind of thing monopolizing things such as healthcare, right? One of the big scares here was that really like what started as a nonprofit here with ChatGPT or the OpenAI company, right, grew into a mega thing. They got all these deals, Microsoft, so on and so forth. And, there's a word, and I forget what the word is, I should have written it down, but for basically when these AI companies get once you get every single data point in the world and you can learn on it, you're just you're going to be able to do anything. You can sell anything, you can do anything, when you really think about all of the scalability and how far that goes. So, I think they were growing really fast. They were doing all those things. And where this guy is I guess the next, Steve Jobs out there, right? Sam Altman, basically, temporarily at least gone from OpenAI. He's working for Microsoft. He's going to build that up incredibly big. It's very interesting. But where you look at that, right, is all the considerations of what is that going to be meaning, right? So Microsoft and Google will have the power to set prices and establish practices for testing generative AI and assessing its risk, asserting a level of control that is not ideal for physicians or patients, especially when a market is just getting off the ground. So, looking at this, some researchers like Duke University and University of Chicago, Brett Bulow Jones, a health data researcher there, noted that experts have been worried about OpenAI becoming more profit-driven even before the recent chaos. So where you guys, look at the priority of that, and either way, capitalism and a free market is the nature of America. So it's going to go somewhere. I think the question becomes, where do you want it to be, right? It has to be regulated to these degrees. People have to have education and understanding of how this is all supposed to look, right? So I'm moving on to Enlightenment Hour here because I think this is important, coming out with a blueprint for trustworthy artificial intelligence and an implementation guide and assurance for healthcare. So this was an interesting, paper that came up. This came through that article that we were just talking about, that I was showing you right here, just on, the standards that are recently kind of starting to be brought up, right? Let's look at this blueprint, whole entire amount of college universities, Mayo Clinic, Johns Hopkins, Duke Health, whole lot of Vanderbilt University, MIT, again. So where we're talking about a big coalition of people and institutions that are getting together to talk about AI, Stanford Medicine, right? And how it should be implemented and regulated. I think this is a really cool, blueprint and things, and just kind of wanted to go over some of the key things. I will put it in the chat notes right here, just the, link to it so you guys can scroll through all the interesting stuff. So, I will give you kind of some of the highlights without cruising through it because I know it's a lot and we're not going to be able to sit there and read that, right, guys? So I got you. Anyways, looking at this. So basically, the whole thing here, we're looking at advancements of artificial intelligence in healthcare, examples of like artificial intelligence and whether it may be, drug discovery or diagnostic tools or patient data analysis, all kinds of, different considerations where really it's going to continue to grow. Like common concerns would be, data privacy, what these algorithmic bases are, what are their potentials for error, right? I mean, I think the most relatable one is going to be like your iRobot, where that robot saves Will Smith at the beginning instead of a little girl that's under the car because Will Smith statistically had a better chance to live. And that, that kind of drove the basis into the movie and so on and so forth. Well, it's just interesting because how is that going to make decisions, so on and so forth. It does need to be addressed by a community, right? So you're looking at, how is it useful, right? You're looking at the key elements of trustworthy AI as laid out in this blueprint. I think, that's important because these elements kind of do bring in together, this whole entire thing. So we're going to look at the first one, right? So useful. So, AI can enhance decision making, for instance, like in pharmacy practice, right? If you're looking at maybe even just for a pharmacist, a final verification check, or whether you're looking at if something's billed correctly by insurance, or you're looking at adherence, or you're looking at the whole scope of it, right? Improving patient outcomes and or streamlining workflow in any other ways, right? How can it make sure that things get addressed, refills, provider outreach, so on and so forth, even patient education, so on and so forth. There's so much. So is it useful, right? So for instance, an AI tool that would predict like drug interactions or patient medication adherence that was built into a pharmacy operating system, it would be different than just a pharmacy operating system that's going to give you red flags. Like this is going to be able to look into a bigger, wholer amount of data, run it differently. It's just going to be interesting where you look at where it's going to come. So I'm, visioning that how it's going to happen. And I think, useful AI is a very key element that we want to make sure does get considered and does get considered properly, right? And so, looking at the other ones here, valid and reliable, right? Safe, the importance of rigorous testing and validation, AI tools in clinical settings. So like, right, you can't just look at something in such a small vacuum and really expect it to work. So the more right data that it's going to be fed, like these bigger places like Mayo Clinic and their big data hubs where they're really starting to train and learn their AI on that, that's interesting to be able to get patient, like for example, like patient monitoring reliable and accurate to avoid right other consequences that could come up. For instance, blood glucose goes off, for instance, heart rate starting to trend up, or what could it be that you might expect and want from artificial intelligence to actually be able to monitor and keep safe, right? So it does have to be reliable, because at the same time, if you're going to trust it that far, it needs to be reliable. So other big part, guys, accountability and transparency. So again, how's that all going to happen? There needs to be clear guidelines and responsibility in case of artificial intelligence driven errors or misdiagnoses. For example, who's accountable if the AI system incorrectly interprets a patient's medical data? You get a misdiagnosis, you get on medicine you're not supposed to have. What path does that lead down, right? In, medical practice, that's lawsuits a la verga. So again, there needs to be accountability measures in place. So explainability, interpretability, stressing the importance of artificial intelligence being able to explain their decision in understandable terms. So, could this actually tell a technician or a pharmacist or, doctor, so on and so forth, why, they're making the decisions that they're making, pull those points, use as examples to justify how a healthcare provider or a pharmacist might actually be looking at data to really determine if something is relevant, right? Like, pharmacists are looking at, and healthcare providers are looking at all kinds of things, especially when you're just going through specifically, right, one journal club, right? What's the confidence interval? And, is this statistically significant? All these very particular things. What are the confounding pieces of data? Like, can you actually trust, that artificial intelligence is fully trained to do that perfectly every single time, specific to that situation? Not sure, not yet, but guarantee it's going to be able to do it better and faster than humans. If it's not already doing it now, but as a resource for everybody, it will. Next, fairness and bias management, right? So the challenge of eliminating bias in these algorithms, right, which would need to ensure equitable healthcare for all patient demographics. So very, very important. How do you ensure, for instance, AI doesn't reflect historical biases in healthcare delivery? So, for instance, if there was, again, like something that would cause you to, maybe compromise your care, and you have some historical bias based on something, and you get placed into hospice and, things like that. For instance, like if you're substance abuse or something in those places, like, can it manage a bias? Can it manage fairness? Can it look in an ethical thought? Artificial intelligence, right? Security and resilience, like how can it actually be safeguarded against cyber security threats, right? Adaptable to the new challenges that are always coming, right? How can it be private and adhere to HIPAA? Can it be trustworthy, right? Looking at all of those things, there's got to be some sort of registry and standardization there. So where we're, needing that right now, you think of things like JAMA or NCBI or some of these things for primary literature. Like, where are you going to get the primary medical, AI like data? And it's got to be somewhere in a way that's standardized to some degree. Otherwise, these things are going to be running wild. And, I think, we're going to end up seeing the reverse of it runs wild before it gets standardized. But again, there's just got to be systems in place overall to be able to address that. I think as a community, as a country, as a whole, again, looking there, like the evolving role of entities like FDA, how does that regulate AI in healthcare? There's got to be other stuff there. So if you guys found some value in that or whatever that you take out of that, I think it's very important to, just think about that, put that in mind. AI is nothing to be terrified of off the get. I think if you had more people optimistic and thinking about the positive ways how to do things, I think we would be able to surmount all the even bad people that would be thinking about it anyways, whether or not, a good person is terrified by AI. So think about all that. I think it's a really good way, thought to approach that on, but maybe that's just me. Otherwise, let's move on, guys, to our Herbal Wellness Corner. So as you guys already saw here, got my High Horse shirt on today. I'm the director of training there, guys. We got the best trained bud tenders in the state of New Mexico. That's for damn sure. Better shop our deals. We absolutely have some fantastic deals going on right now this week to stock up on some quality cannabis, quality concentrates. Guys, looking at this at High Horse Cannabis, if you're not seeing on the ticker here, all week long, $15 eighths, $70 ounces at High Horse Cannabis, half off of Farmers chocolates and infused fruit pre-rolls, $20 for every Farmers concentrate gram. Guys, these are like some insane deals. It's Black Friday week. I really, really expect you guys to be shopping. You're going to be stocking up on your medicine, so on and so forth. So I highly, highly recommend you browse that menu. You go check them out. Stock up for the holidays. Grab yourself something Pharmtrue while you're at it. We're in that menu too, but otherwise, got a little bit of something for everybody for sure. And that's definitely what we're highlighting right now in our Herbal Wellness Corner, brought to you by High Horse Cannabis Company. Boom, boom, HH, baby. All right, so let's move on. Community Spotlight. Shouting out the city of Las Cruces. So city of Las Cruces, give me 2 seconds, pull that up. Paid partnership here with the senior program, so I thought this was pretty cool. So join the City of Las Cruces senior programs in our Food for Paws pet food drive throughout November. Drop off dog and cat food at any of these locations. So they're all listed here. I'll put them in the chat. Again, hopefully helps, a senior get some animals their food, looking at where the Food for Paws locations are, guys. Boom, boom. This is how you'll find it. I think it's a cool initiative. Great time for gratitude. Obviously, there's American Red Cross. There's all these things to give back with right now. Completely understand it. So pick and choose, and enjoy. Enjoy your time with your friends and your family. If you're working, thank you. Anyways, check this out. Last thing for our Men's Health Minute tonight. 4 things every man should do in Movember. I think the first one is the one that's most relevant for me. I think it's the best one. Schedule an appointment even if you're not sick. So again, men are 70% less likely than women to seek treatment for illnesses. Men, so it makes sense. Got to get a checkup in. So, if you're going to grow a mustache, if you're going to eat a well-balanced diet, if you're going to increase your vitamin D intake to try to, curb some of the things like the seasonal affective disorder, sure, great. Make sure last time you've seen was in a relevant amount of time. And that's the best way we can do it for our Men's Health Minute tonight, guys. But we'll leave you at that. Hope you enjoy your Tuesday. We'll just hit you for a quick one tomorrow and be Thanksgiving, hit you on the next day. And other than that, it's Dr. Joaquin. Ask me some questions if you need them. Shop that high horse. You already know. Chaperone the Mexico state line, Hobbs state line, Las Cruces, New Mexico, Maine, and Valley.